When is tissue grafting needed for reconstructive surgery? Imagine losing a part of your skin or tissue due to injury or surgery. Sometimes, simple stitches or natural healing just aren't enough to restore what's lost. That's where tissue grafting comes into play. It's a specialized procedure used when there's significant tissue damage or removal that can't heal on its own. For example, after removing a skin cancer, large areas of skin might be excised, leaving a big open wound. In such cases, grafting helps cover the area, protect underlying tissues, and promote healing. Tissue grafting is also essential in cases of deep burns that destroy layers of skin and underlying tissue. When wounds are chronic and don't heal properly, like diabetic ulcers or venous leg ulcers, grafts can help jumpstart the healing process. Traumatic injuries that cause extensive tissue loss or damage may also require grafts to rebuild the affected area. If a wound is too large or under too much tension to close with stitches alone, grafting provides a way to cover the defect without putting too much strain on the surrounding tissue. In reconstructive surgery, the goal is not just to close a wound but to restore both appearance and function. For skin, this might mean choosing between split-thickness grafts, which include part of the dermis and are good for covering large areas, or full-thickness grafts, which include the entire dermis and are often used on the face for a better match in color and texture. Grafts can also be used to repair deeper tissues, like fascia or muscle, especially when structural support is needed, such as in facial reconstruction or tendon repair. The success of tissue grafting depends heavily on the blood supply of the recipient site. The area must have good circulation to support the transplanted tissue. Donor sites are chosen based on the type of tissue needed. Common sources include the thigh for fascia or the scalp for certain skin grafts. The size and depth of the defect, the location, and the patient's overall health all influence the type of graft selected. In the context of skin cancer treatment, after removing a tumor, grafting helps close the wound efficiently. It protects the underlying tissues, speeds up healing, and improves how the area looks afterward. Surgeons carefully select the graft type to match the size and location of the defect, aiming for the best functional and cosmetic results. Remember, tissue grafting is a complex process that requires careful planning and execution by experienced surgeons. If you're facing reconstructive surgery, it's important to discuss all options with your healthcare provider. They can evaluate your specific situation, including the size and location of the tissue loss, and recommend the best approach to help you heal well and look your best. Always seek personalized medical advice for your unique needs.